name is Susan Salvo, and today we're going to learn a low back technique we call the rainbow technique. This is Michelle. She's going to be my volunteer today. We're going to start by pretending like we've already massaged her, and she's indicated that she has low back pain, so we're going to put her into a position that targets the quadratus lumborum muscle and also the psoas muscle, okay? So let's start by having her rotate away from you, quarter turn. And the QL has attachments onto the rib and also on the iliac crest and also on the lumbar vertebra, transverse processes. And I have to lengthen this muscle a little bit. So what I'm going to do is I'm going to take her arm, put it over her head here. It's going to raise the rib cage a little bit. I'm going to take this bottom leg and I'm going to move it back and down the table. So notice how her ankle and foot are off the table. I'm going to take the other leg and either bend it or have her bend it up. And the rainbow comes from this arc starting at her wrist all the way down to her ankle. So this is the rainbow. So what I'm going to do is I'm going to start by putting some cross fiber friction on the QL, which is right here. So you can see my fingers going down into it. How's the pressure? Good. And you can do a pincer grip, which is really easy on her. Literally, that is it in my hand. You can do direct pressure going this way. And what I like to do is I like to, even though I'm here on the QL, of course you stop when you hit the sacrum. And as you can tell, I'm really digging in there quite a bit. I like to extend up even past the 12th rib, going up just a little farther up. And we'll hit those again in a few minutes. Now to get the psoas muscle goes from the lesser trochanter onto the anterior aspects, anterior transverse process of the lumbar vertebra. So they're kind of like mirror images of each other in that respect. So what I'm going to do is I'm going to take her leg and I'm going to hold it on my hip with my hand. And I want you to notice how the hip and the knee and the ankle are all in the same plane, okay? And what I'm going to do is, because I know she's limber, I'm going to step back and I'm going to start by hyperextending her hip while I am stretching her leg. And she's going to get a little pull back from that bottom leg, and that's fine. And then I'm going to instruct her to take her knee and move it to her abdomen, okay? And I'm going to give you some resistance, okay? We're going to do this for 7 seconds. Let's begin now. 1, 2, 3, 4, 5, 6, 7, and relax. Now, once she's nice and relaxed, I'm going to extend it back some more. And I'm feeling it a little bit easier. Does it feel easier to you, Michelle? Mm-hmm. And then you're going to do this 3 times. I'm only going to show you once, but you're going to do it 3 times. The next thing you can do is you can take her leg, put it on top of her bottom leg, and get to a fetal position for me. You can have a pillow here if you like. And even tuck your chin down too. Okay? So just cause that whole spine to lengthen. I'm going back again to the back, starting where her sacrum is. I'm going to start using, this is more of a circular friction, but you can be straight, static friction. It can be cross fiber friction. It really doesn't matter, but you're going to move all the way up on her back. I'm using on one side of the spine now, but I can do both. All the way up. I like to go to about the bra strap area. Then what I'm going to do is I'm going to start on the back again, here, and I'm just going to bend down and keep my elbow extended and my wrist straight. And I do use a rocking pressure, and it just works for me. Hopefully it'll work for her. And going again, up the back, about to the area where her bra strap is. Here. How you doing, Michelle? You like it? Mm-hmm. Good. And then you can do both sides with the same, woohoo, hello. I think I'll hang out here a while. What you think? Mm-hmm. Take some breaths for me, please. Nice deep breaths. That's good. And make sure you do the other side. Let's just demonstrate that rainbow technique one more time. Go ahead and turn over toward me now. Okay, so the top arm is going to be over your head here. The bottom leg is going to be bent towards your abdomen. Top leg is going to be down this way. And again, this is the position that the body's in to get that rib cage lifted up and the hip bone lifted down. And you really can work it this way too, with me standing on this side of the table. It's a little harder on me. I think I'd rather be on that side of the table. So here I am focusing on, where's your spine? I've lost your spine. Here it is. Pushing into the spine, grabbing her QL. Ooh, hello. Yeah, this is kind of tight, huh? A little bit tighter than the other one. And I'm going up again. Woo! Can you see that? That is her paraspinals. Also a major contributor to low back discomfort. And then a little bit of the stretch of the psoas. When you do this stretch, I want to remind you to go not on her sacrum, but just above her sacrum when you're leaning back. Make a wish. Just kidding. Okay, let's do one of those again. 7 seconds. Begin. 1, 2, 3, 4, 5, 6, 7. Relax. And very nice. And fetal position. And then you can do some more. This time I do both sides of the back with the circular friction on the paraspinals. I hope you've enjoyed this little demonstration. I hope you can give your clients a lot of relief from their low back discomfort. Thank you.